Hi boys and girls, welcome to George and Willy's World. We're so happy you could be with us today. I'm Mrs. Krantz and this is my dog George. And George brought her puppy with us today because Willy and Mrs. Mapes aren't here. They're in San Francisco because Mrs. Mapes had to go to the doctor again. But she and Willy will be back for the next show. And George loves to play with Willy. She really looks forward to seeing him when we come to the TV studio. So I thought if we brought her stuffed puppy, at least she'd think she had a little friend with her today. George has been very busy working at Alta Sierra School, helping a second grade class become better readers. And she also works on Wednesday afternoons at the Madeline Helling Library in Nevada City. And if you would like to read to George or tell her a story or just come and say hello, we would love to see you there. We're there every Wednesday from 4 to 5 o'clock, and you can call the library and just say you're going to come in and read to George, or if you show up, we'll always have time for you to meet George and give her a pat. Today, we have a very special guest. We have Dr. Schultz with us, and Dr. Schultz is a dentist. And dentists are special people who help us keep our teeth healthy and also help us fix our teeth when there's something wrong. So welcome, Dr. Schultz.
Thank you.
I'm so glad you
happy
could
to
be here today. I'd like to ask you a little bit about, when did you decide to become a dentist?
I decided to become a dentist when I went on a trip to another country and I saw children that didn't have any dental care available to them, and they were suffering a lot. And I thought that having your teeth be healthy was a really important thing, especially if there's no one there that can help you take care of them. So that's what made me decide to do that. And I went back to school, and it was a long time before I finished.
Yes.
And then after I finished school, I came back to this area and started working.
So do you work with children as a dentist? Or?
Yes, I do. I have a special dental program. I have a dental office that's very unusual because it folds into a suitcase. In my dental office, everything folds up into a suitcase, and I carry it to the school, and I see children right at the school. And we have 14 schools here in Nevada County that we visit, and some of you may have seen me because I'm at all the Head Start programs in Nevada County as well. And so I see the children there.
Oh, that's great. So you do basic checkups for all the children?
Checkups and preventive services, yes.
Oh, that's wonderful. I didn't realize that the schools had a program like that.
It's brand new this year.
Aha. Yeah, so your specialty is children then?
Well, no.
No?
It's just what I'm doing right now.
Uh-huh, uh-huh. Okay, and what children expect if they go to the dentist's office for the first time?
Well, when you go to the dental office, it looks very strange because it's different than any other room that you've ever been in. First, the dentist has a special chair, and when you sit in the chair, it's a little bit like being in a rocket ship because the chair can go way up high and all the way down low just by pushing a button. Also, the chair folds back so you can actually lay down in the chair. We don't have chairs like that in our living room. It's a special chair for the dental office. And there's a very bright light so that the dentist can see your teeth very well because they have to see all the way back to the very back of your mouth. And there are a lot of noisy things in the office. There's something that squirts water and something that squirts air. And then there's a whirring sound for the tooth polisher, a little bit like an electric toothbrush.
Mm-hmm.
So those are some of the things that you see in the dental office. And you also might notice that the dentist is dressed differently than other people. They have some special things. For example, I'm wearing a special jacket that I wear when I work, has my name on it. And this is to protect my regular clothes that I wear outside and to keep things from splashing onto my regular clothes. Then when I'm at work, I also wear special gloves, rubber gloves, to protect my hands and keep them clean. And then I have safety glasses that wrap all the way around and keep things from splashing in my eyes. And I wear a mask over my nose and my mouth so that I don't breathe all over you. And those are some of the special things that I wear. And the other people that work with me, my assistant and my hygienist, also wear those special clothes too. So we look different when they're in the office. It's a little bit of an unusual place, but it's lots of fun. We have a lot of fun things we do there.
Really? Oh, that sounds great. That sounds great. What's the favorite part of your job?
My favorite part of my job is helping children have healthy teeth.
Mm-hmm. Yes. And so visiting the dentist and having checkups is a part of that, and also eating properly?
We talk about that too. Yes.
Mm-hmm. Great. Well, I understand you have several books that you'd like to read us, so why don't we start with the stories?
Okay.
Which is the first one?
The first book that I'm going to read is called Oliver's Vegetables, and it is written by Vivian French and illustrated by Allison Bartlett. You know, vegetables are very important, so this is a book about eating vegetables. Finish up, Oliver, said his mother, or we'll miss the bus. Can't we walk to Grandpa's house? Asked Oliver. No, said his mother, it's too far. Hurry up. The best thing about Grandpa's house was the wonderful garden. I grow all my own vegetables, Grandpa said proudly. I don't eat vegetables, Oliver told Grandpa. I only eat French fries. If you want French fries, said Grandpa, you must find the potatoes. If you find something else, you eat that and no complaints. Is it a bargain? Oliver ran around the garden, but he couldn't see any potatoes. They must be hiding, he said, and pulled at the nearest leaves. Carrots, said Grandpa, just the thing for Monday supper. That night, Oliver ate his first carrots. Oliver took a long time making up his mind on Tuesday. Gran and Grandpa came to watch him. Those crinkly leaves are pretty, he said at last. Are the potatoes there? Spinach, said Grandpa. They had spinach for supper. That was good, said Oliver. On Wednesday, Oliver got up early. Potatoes are very important, he said, so they must have big leaves. Here they are. Grandpa smiled. That's rhubarb. They had rhubarb pie that evening. That was very good, said Oliver. It rained on Thursday. When it stopped, Oliver hurried outside. Have you found the potatoes? Grandpa asked. No, said Oliver. I found slugs and snails. Are they eating my potatoes? Grandpa shook his head. That's cabbage. Oliver had 2 helpings. Very, very good, he said. On Friday, Oliver was sure that he had found the potatoes. When he pulled at the leaves, up came a bunch of beets. Oliver ate all of his beet salad. Very, very, very good, he said. On Saturday, Oliver played soccer. The ball landed in a tangle of sticks and leaves. Oliver was sure the potatoes weren't there, and Grandpa nodded. Peas, he said. Oliver had 3 helpings of pea soup that evening. Was it good? Asked Grandpa. No, said Oliver. It was delicious. Oliver rushed into the garden on Sunday. Here they are. How did you know? Asked Grandpa. They were the only things left, said Oliver. Can we have French fries now? Oliver asked. You scrub the potatoes, said Gran, and I'll peel them. Grandpa can cut them up. Oliver, Gran, and Grandpa sat down to eat. The door opened, and in walked Oliver's mother. She saw the plate of French fries. Oh dear, I did hope Oliver would eat something different while he was here, she said. Oliver and Grandpa looked at each other. His mother stared as they laughed and laughed and laughed. The end.
Oh, that's a great story. And you know, George loves vegetables. George eats lots of carrots and string beans and jicama and all kinds of vegetables. And George has very healthy teeth, so maybe that's part of the reason.
You know, dogs need to visit the dentist sometimes too. Has George ever visited the dentist?
Yes, actually, George, the last year when she went for her yearly checkup at the veterinarian's, she had her teeth cleaned. Yeah, and I brush her teeth a few times a week. She doesn't like it very much, but she does let me do it. And she has special toothpaste for dogs. Yeah. So what is our next story?
Our next story is called Your Smile Counts. And this is a special story about visiting the dentist.
Oh, great.
Can you help me with this?
Of course.
George, do you want to help too?
Yeah, I think she does.
Okay. 10 healthy children, mouths open wide, counting up their baby teeth, 20 inside. 10 on the bottom and on the top too. Healthy teeth, clean teeth, smiling at you. Now when you look at your mouth, you have teeth on the top and the bottom, and they're very small. Those are called baby teeth. And when you get a little bit older, those teeth get loose and they wiggle, and pretty soon you wiggle them all the way out, and you have a space there, but it doesn't stay very long because pretty soon a grown-up tooth comes in its place.
And it's okay to wiggle them and
Oh, yes.
get them out?
That's part of the job. 9 children using their teeth to chew, to talk, to smile, and crunch food too. Teeth that make their smiles just right from early morning to late at night. So here's some children busy at school, and it's talking about some of the things that our teeth do for us. So our teeth help us to smile, they help us to talk, and they help us to chew, all important things. 8 children hungry, what should they eat? Let's make a list of healthy treats. Carrots and cheese and apples too. What healthy foods sound good to you? Can we think of some other snacks that are healthy? We already read a book about vegetables. We know that vegetables are healthy.
How about fruit?
Fruit is very healthy snack. And it mentions cheese here, another healthy snack.
Are nuts good?
Nuts are good. Popcorn is a good snack, and pretzels are a good snack. What are some snacks that might not be so healthy? Mostly really sticky and sweet foods. So we
Candy
have...
wouldn't be a very good snack.
What?
Candy wouldn't be a very good...
Candy's not such a great snack. It's okay once in a while, but not all the time.
Right.
And other really sticky foods like crackers are really sticky and not such a good snack.
Ah.
Okay? Okay, here we see some children brushing. 7 children brushing, starting at the top, moving to the bottom, but they don't stop. Inside and out till each tooth is clean. The brightest smiles that you've ever seen. So we talk about brushing our teeth. You know, it's important to brush not just once a day, but twice a day. And the best time for brushing is after breakfast in the morning and before you go to bed at night. Twice a day, after breakfast in the morning, before you go to bed at night. And I think most of us need a little bit of help, so Mom and Dad, if you could check and make sure that your children are doing a good job. It's okay for them to brush, but you need to check and make sure they got all the spots. 6 careful children think safety is cool. They play safely at home and safely at school. Can you tell them how to be smart just like you? To keep their teeth safe, just what should you do? What do we think about when we think about keeping our teeth safe? Well, we don't want to knock them against anything. We don't want to bump into other children and knock them down. So mostly it's just being careful. And also, when you play sports when you get older, there's something called a mouth guard that you wear in your mouth to protect yourself when you're playing softball or soccer or any of those sports. Very important to protect your teeth. Okay, we have a special picture here. Remember I was telling you about the special chair in the dental office? Well, here's a picture. 5 curious children looking all around. They know about the chair that goes up and down. They learn about the tools and the great big light and choose new toothbrushes to use tonight. These children are having a good time at the dental office, and the dentist is showing them all the different things in the office. We see the great big light right here over the chair, and here's the chair that goes up and down. And look, here's a little boy riding in the chair. Four smart children who've been here before know what to do when they come through the door. A smile from the dentist, then mouths open wide. Getting cleaned and polished sometimes tickles inside. Now we talked about some of the special things that the dentist wears. You can see a picture of some of those things. This lady here is clean, polishing the teeth, and you see she's got a mask over her mouth and nose. She's got special glasses to protect her eyes, and she's wearing special gloves to keep her mouth clean. To keep her hands clean and protect your mouth. So sometimes it tickles a little bit like an electric toothbrush can tickle. I don't know if some of you have electric toothbrushes, but it's very similar to what happens at the dental office. And here's a child down here that's a patient in the office, and they have a special napkin to put over their shirt so nothing splashes on their shirt and it stays nice and clean. Three children brushing after snack at the sink, scrubbing and swishing. Now what do you think? After brushing and rinsing this time every day, their mouths feel clean and they're off to play. Now some of you that go to preschool may have a toothbrush at school where you brush during the day, and that's great because we want to get the sticky food off our teeth as soon as possible. We talked about the 2 times to brush, and we have a special picture of that right over here. 2 children ready to brush, brush, brush. At home like at school, they never, never rush. One brush is green, the other brush red. 2 children brushing, then it's off to bed. So these children are brushing before they go to bed at night. And then the other time you want to brush, after breakfast in the morning. And one thing about brushing your teeth, we only want to put a tiny little bit of toothpaste on your toothbrush. Toothpaste is not for eating, it's just to put a tiny bit, about the size of a pea, and that's plenty, no more than that. One child smiling with teeth so bright, knows what to eat and how to brush right, goes to the dentist's place safely too. Who is that special person? Of course, it's you.
That's great. Okay. So we have a little chart here that you could make at home to remind your children to brush their teeth and kind of keep track of their tooth brushing. And so Dr. Schultz said that the most important times are after breakfast and before you go to bed. So if you brush your teeth after breakfast, you could get a star, and at bedtime you could get a star. And if you did them after lunch or dinner, that would just be bonuses. And then at the end, you could add it up, do it by the week or however you want, and you could always maybe get a little prize once you've done it for every after breakfast and at bedtime for a whole week or a whole month. But the most important thing, I think, is to get into the habit of brushing your teeth and brushing properly. So since probably our parents are going to be helping the children brush, how long roughly should someone be brushing their teeth?
Well, one of the nice things about electric toothbrushes are that they have timers on them. Mm-hmm. And the timers are for 2 minutes. And so you brush as long as the timer is on, and then you don't have to think about it. But 2 minutes is a good amount of time.
Okay.
And that's a long time when you're brushing your teeth. You think you're all done, but it's only been 20 or 30 seconds. And so sometimes maybe if you look at the clock or if you have an egg timer of some sort, you can check and see how long is 2 minutes of brushing your teeth. And if you get all done and it's not 2 minutes yet, start all over and do it again, and then have mom or dad check. One of the things that we do in our program at schools is we have the children brush, and then we have a special pink tablet that we have them chew up, And the tablet shows where they missed. And so they can go back and get those spots that they missed and brush again. And the children always say, I thought I brushed every spot, and look at all this pink on my teeth. And then they go back and brush again. So that's something that you can pick up at the store, mom or dad, and have your children check their brushing at home to see how good of a job they're doing.
Oh, that would be fun. I didn't realize you could buy it at the store and try it. Yeah. And should young children floss, or is that when you get a little bit older?
Children are not really able to floss themselves until they're about 7 or 8 years old. So mom and dad need to floss them. And we recommend that as soon as there's teeth that touch each other, if the teeth are separated, like the first baby teeth, you don't need to floss those. But if the teeth are touching each other, one right against the other, we need to get a string in and clean that area. And the easiest way for parents or young children to floss is the kind of floss that comes on something that looks a little bit like a fork, like this, has a long handle, and it comes down like that, and the thread is between the two prongs. Then you just hold the handle and floss the teeth like that. It's much easier.
Right. I have one of those at home. And so I don't know if all the boys and girls know, how many sets of teeth do you have or do you get?
Well, little babies, when they're first born, they have no teeth at all. And they don't really need teeth because what do little babies eat? They don't have to chew anything, do they?
Right.
They drink milk mostly or formula. Mm-hmm. So then when you get a little bit older, maybe about 6 months old or a year old, you start to get some teeth, and they're little small baby teeth. And those you keep until you're much, much larger and you have room in your mouth for bigger teeth. Because if you had grown-up teeth when you were very young, there wouldn't be room for them. Our mouth is much smaller when we're young. So you need to get the larger teeth when you're larger. Mm-hmm. And that's why we get those. So 2 sets of teeth, baby teeth and grown-up teeth.
So we have to take really good care of especially our grown-up teeth.
All the teeth, they're all important. Mm-hmm. Now also we talked about visiting the dentist. And we like to see children visiting the dentist twice a year, and the first visit should be as soon as the first teeth come in. So that would be starting about 1 year old. We would like the dentist to just take a quick look and see how everything's coming in. And then about every 6 months after that, come in, have the dentist check the teeth, have the teeth polished. And there's a special medicine that we paint on the teeth at the dentist office. It's called fluoride. And it has a special medicine in it that soaks into the teeth and makes them super strong so they don't get cavities. Cavities are something that we don't want the teeth to get because then they need to be fixed. Mm-hmm. So if we eat healthy snacks, brush our teeth twice a day, and visit the dentist regularly, then the chances are we won't get very many cavities at all.
Oh, that sounds very good. I'm sure a lot of the parents who are watching the show I didn't realize that you need to go to the dentist when you're that young.
Well, it's kind of a change. It used to be, they used to say around 3 or 4 years old, and now they're saying they want to see them right as soon as they get teeth.
Right.
And the reason is because children younger and younger now are being exposed to things that can cause cavities. So we're seeing the cavities start younger and younger. Mm-hmm. When you and I were children, we didn't go to McDonald's when we were 1 and 2 years old, but now it's more and more things that the kids get exposed to.
Right. Well, George actually had fluoride on her teeth when she was less than a year old, and she has very good teeth, so maybe that's part of the reason the doctor put some fluoride on her teeth. So I think it's important for our animals as well as ourselves to eat good food and not to snack too much, and visit the dentist or the veterinarian and have your teeth taken care of and checked. I think that's great. I think it sounds easy if it becomes a habit.
It is, yes.
Yes, it is. So we've just really enjoyed having you on our show today. So much information and good stories. We really thank you for being here. And if you'd like more activities, things to do, you can look at the community calendar on Nevada County TV. There's always lots of things going on in our community that are great to bring your children to. We'd still love to hear from you. If you'd like to write George and Willy at George and Willy's World or Nevada County TV at 235 South Auburn Street in Grass Valley. And you can email George and Willy at georgeandwilly@yahoo.com. And we promise if you write us or email us that George and Willy will answer you. We'd just love to hear what you think about the show, or if you have any ideas of people that you'd like to see on the show. And you can also borrow the DVDs of the George and Willy shows by going to the Nevada County Library, the Grass Valley Library, or Sierra Nevada Children's Services. And they have the really nice sets of some of the shows available for you to borrow. So please remember to do all your jobs, listen to lots of stories, and have fun playing. And we hope that Dr. Schultz will maybe be able to come back to the show again and tell us how to keep our teeth healthy. So goodbye for now. We've really enjoyed seeing you, and we look forward to seeing you on our next show.